Many people may not be aware of this, but it's National Eating Disorders Awareness Week. And during the pandemic, the need for help has been on the rise. To talk more about this, we're going to bring in Dr. Olivia Thakkar. She is a psychotherapist over at the Birmingham Maple Clinic, our good friend here on the MegaCast. We love talking with all the experts over there at your clinic.
Thank you for having me. Yeah.
So tell us how it's been for you treating some of the individuals during the pandemic right now.
We have definitely seen a rise on the number of calls and people experiencing eating disorders either for the first time or people that have been on recovery for a long time and are seeing it reemerge now.
And what do you think is the underlying contributing factor to that?
Well, we know that there is a common link between eating disorders and trauma. And I think that in many ways this year has been very difficult for people. And that it has been, in a way, a collective trauma. So it's not surprising that this is happening. I think that we see eating disorders as a way to cope with stress, and it can be triggered by environmental stressors. And this year has been just very difficult.
Doctor, is it just me, or it seems like in the past 10, 15 years, we haven't been talking about eating disorders like we used to. Now there seems to be more of a focus on drugs and alcohol use, but we're really not talking about the eating disorders. It seemed like it was a big topic back when I was like in high school and college.
Yeah, I'm not really sure, but I think that we have seen over the past 30 years an increase in research and treatment of eating disorders. There's better diagnostic tools, but there are other concerns as well, especially with young people.
So if I'm a parent, what should I be looking out for to know this is the time to get help versus this just kind of normal way to deal with the stress, because we all laugh and we call it the COVID-15.
Right. Yeah, I've heard that a lot. I would say that parents, look out for signs that can be very subtle and sometimes drastic, like drastic weight loss in a short period of time, but also rituals around food, such as cutting out whole food groups from their diet, all of a sudden becoming vegan or vegetarian, having some behaviors like cutting food in very small pieces or disappearing after meals, going to the bathroom, anything that are red flags that would be that there is an eating disorder that could be going on. But I would say that especially excessive preoccupation with weight, shape, and appearance. If you see that in your kid, body image dissatisfaction, I think it's time to look for help.
How much do you think social media is playing into sparking some of the disorders?
I think it's a problem, and I think that it is a big contributing factor to eating disorders right now because of the social pressure. We're all immersed in this culture, this diet culture, and kids see this everywhere on their Instagram account. It follows them home. I think that there's a big pressure to be thin.
Yeah, hey kids, those Instagram pictures, there are things called filters and editing, and they probably took 100 to get that one image. So, we have to kind of remember that social media is not reality media.
That's right, yeah.
So you're treating some of your patients. How is it working right now with COVID-19? Are you able to see them in person at all?
Right now we're doing virtual therapy, and we work with often with a multidisciplinary team. So they do go to see a physician that specializes in eating disorders, and there is a dietitian that is working with them as well. So I am doing right now virtual therapy, but they are seeing other members of the team in person.
And are they able to utilize any apps to help in the treatment? Because it seems like there's an app for everything right now.
There are certain apps, definitely. But I think that does not replace the connection with the therapist, right? With their physician, with real people.
Right. So we talk so much more about eating disorders. We just assume it's people anorexic, but overeating during this time is a big issue as well.
Right. And I think that our relationship to food is so complex, right? That many times food serves as a source of comfort for so many people. And many times it is a way to, it is a form of control. It just depends on the person's background. So it can serve, overeating is a problem. There's easy access to your pantry all day if we're working from home, right?
Dr. Olivia Thakkar with us here on the Megacast. She is a psychotherapist from the Birmingham Maple Clinic. Is it harder for people with eating disorders to overcome them because we need food to survive?
Exactly. So it's not a all or nothing approach to recovery. It is more about finding balance, finding moderation. But it is possible to recover. We know that early intervention is the best way to recover. So treating them as soon as there are signs that they're struggling, it really offers the best chance of recovery.
So what age group are we looking at here?
So in general terms, I would say that eating disorders affect 90% of people with eating disorders are in their early teens to up to 25. Some of them are younger, some are older, but that's the age group. But it affects all age groups, all races, gender identity, sexual orientation, socioeconomic background.
So along with the food, should the parents also look at the exercise activity of their child as well?
I think so. I think that especially with bulimia, there is, with bulimia nervosa, there's a tendency to overcompensate for binge eating. And one of the ways that people find to compensate to avoid weight gain is through excessive exercise.
So if someone is on the edge and they're struggling, what do you want them to know?
I want them to know that there is help out there, that there is a chance of recovery. It really is about looking at life as more than an eating disorder, finding things that make their life more meaningful, but definitely connecting with a mental health provider and asking for help.
So, we know that when we're dealing with alcohol or drugs, there are certain programs and detox programs, but what is the treatment for trying to help someone with an eating disorder?
So I think it depends on the severity of the eating disorder. We have the least restrictive kind of treatment, which is the outpatient treatment is what I do, where people will come in maybe once or twice or maybe 3 times a week, and talk about behavioral strategies that they can adopt to cope with the eating disorder and recover. There's also a day treatment where they go somewhere, maybe a hospital or a clinic, and they spend a day there. There's group therapy, medical care. And the most restrictive kind of treatment is hospitalization. Those are people that really, their medical status is really severe, and they need to be monitored and supervised all day.
So is this like drugs and alcohol where someone could struggle with it for the rest of their life? They just know that, hey, this is what I'm going to have to deal with.
They could, yes, definitely. Or they could, if they find help early, there is a great chance of recovery, 100% recovery.
I guess I should have asked you at the beginning of this, but what are some of the different eating disorders?
Okay, so there are various types of eating disorders. The most common are anorexia nervosa, bulimia nervosa, and binge eating disorder. So with anorexia nervosa, what we see is excessive preoccupation with weight, shape, appearance, and control over eating. And there is a tendency to restrict calories that leads to a dramatic weight loss. There's also this disconnect between what they experience and what they see in the mirror. So they see themselves as larger than they actually are, and they can't recognize the severity of the condition. With bulimia, there are episodes of binge eating. They're followed by compensatory behaviors such as vomiting, using laxatives, diuretics, or overexercising. And then with binge eating disorder, we're talking about the sense of a lack of control over eating. The binge eating episodes where people feel a sense of lack of control and a lot of guilt and shame and disgust with themselves.
How much does family dynamic play into someone developing an eating disorder?
Well, I think it could be a contributing factor. It could be a stressor if there's a lot of family conflict. But I think that families can be their best allies too, in helping the recovery and helping keep people accountable and supporting them. It just depends on the family system.
Hey, you see some parents where it's like, eat, you did something good, here, have a cookie, let me make you cookies. And then other families where it's like, everything's organic, we don't eat meat, we don't do this, you only have so many calories through the day. And, you kind of look at that and how that can impact your kids long term as well.
Long term, yeah. Definitely. But we know that the eating disorders have a strong genetic component. So there's usually a family history of eating disorders or substance abuse many times, and depression. So there is a genetic component, that it's interesting to see how everybody, at some point in their lives will follow a diet, right? But only a certain amount of people will actually develop an eating disorder. And those are people that have predisposing factors that make them more vulnerable to it. And I think genetics play a strong part in it.
Dr. Olivia Thakkar with us here on the MegaCast. She's a psychotherapist over at the Birmingham Maple Clinic. Doctor, anything maybe we didn't touch on that you want to share with us before we say goodbye?
I would like to say that there is hope, that we know a lot more now about eating disorders than we did 30 years ago. There's a lot of research, cutting-edge treatment, and that people need to ask for help and recognize, the severity of it, and help is out there.
So do they still have a hotline available for people?
They do. NEDA the National Eating Disorder Association has a hotline, and it's on their website.
Okay. Well, we so appreciate your time today.
You're very welcome. Thanks for having me.